Spain's national health system is based on the principles of universality, free access, equity and fairness of financing. Overall health status continues to improve in Spain, and life expectancy is the highest in the European Union. Let's talk about some statistics about healthcare providers. There are many types of healthcare provider in Spain, as public and private hospitals, clinics, emergency rooms, pharmacies, etc. Looking at expenditure by the different healthcare providers. The expenditure of hospitals, which in 2014 was 39,930 million euros. That represents the highest percentage of the total healthcare expenditure. More specifically, in 2014, the country's hospitals generated 41.7% of the total health expenditure. That of outpatient care providers was 25.8%. 22.0% for retailers and other providers of medical products. And that of residential care establishments was 5.4%. The contributions of the main healthcare providers to the total health expenditure have been disparate during the period from 2010 to 2014. The expenditure corresponding to hospitals rose by 0.7 percentage points. And the expenditure of retailers and other providers of medical products like pharmacies rose by 0.2 percentage points, while the expenditure of outpatient care providers fell by 0.3 percentage points. And that of residential care establishments fell by 0.5 percentage points. Now about the expenditure depending on the income of residents. In Spain there is no differences between residents by income in medical examination, as the percentage of unmet needs for medical examination due to economic reasons show negligible differences between the better and worse off. This was not the case for unmet needs in dental care, due to economic barriers, as the percentage increased in the lowest income quintiles, while in the better off, figures decreased, from 1.2% in 2008 to 0.9% in 2015. In the worse-off individuals, unmet needs rose from 7.0% in 2008 to 10.5% in 2015. Let's talk about health expenditure by health status. Firstly, there are 9 types of health status according to clinical risk group. 1 healthy, 2 history of significant acute disease, 3 single minor chronic disease, 4 minor chronic disease in multiple, 5 single dominant or moderate chronic disease, 6 chronic disease in 2 or more organs, 7 dominant chronic disease in 3 or more organs, 8 dominant and metastatic malignancies, 9 catastrophic conditions. By health status, the healthy status only constituted 13.34% of the total expenditure, in spite of being the largest as their population is 54.63%. In health status type 3 also, the proportion of population was slightly greater than the cost. But in type 2 and 4 the percentages of both were similar. For health statuses 5 and 6 together accounted for more than 50% of the total expenditure while only representing 25.87% of the population. Lastly, the most serious health statuses type 7, 8 and 9 held only 1.42% of the population but generated by 12.64% of the total expenditure. Differentiated by age range, sex and health status. The total expenditure for each of the age groups from 15 to 44 and 65 to 74 was in the order of 32 million euros. In the first group the total expenditure for women was 18,596,376 euros. And for men 11,814,668, a difference caused fundamentally by health statuses 1 and 2. In the age range of 65 to 74, expense was similar in both sexes, 16 million euros, and had the same distribution by health status. The age range 75 to 84 was the group with the third greatest total expenditure, with 14,194,382 euros for men and 14,502,472 euros for women. With a similar distribution in regards to the total expenditure by health status. However, looking at average expenditure, the age range from 75 to 84 had the highest, with €9,946 for women and €8,696 for men. Finally, we will talk about public healthcare expenditure across Spain regions. In absolute values, 44.4% of this sector's public expenditure on health was generated by three autonomous communities: Catalunya, Andalusia, and Madrid, which spent €9,205 million, €8,737 million and €7,423 million, respectively. In contrast, La Rioja, Cantabria and Navarra were the autonomous communities generating the smallest expenditure. Relative to their population, the autonomous communities with the largest public expenditure on health were País Vasco with €1,582 per capita, Extremadura with €1,448 per capita and Navarra €1,435 per capita. The communities with the lowest public expenditure on health were Andalusia with 1,042, Madrid with 1,164 and Baleares 1,194 in terms of euros per capita. Thank you for listening.